my friends here at the village, and I'm here primarily to introduce my colleagues from our division at Bethesda Village Medical. Can I be heard?
No.
Folks? I think I have it on.
You have to turn it.
Oh, okay. Oh, okay. Yeah, and I'll just talk louder. So I say I'm here to introduce our program, InfoSAGE, to you, and I'm blessed by having two of our colleagues here who will fill you in on the details of what I consider to be a very exciting program that I hope will be of help to you all in the future, or all of you who would be interested in joining us with this. By way of a little history, I had as a house officer and then on the faculty, I had the great pleasure of spending the decade of the 1960s at the University of Wisconsin in Madison, where a wonderful atmosphere of strong social conscience and progressive ideology pervaded the campus. And it was there that two lines of reasoning evolved in my mind. First, that the computer could be used wisely and well in the practice of medicine. And this led to my early research with the use of the computer program to interact directly with a patient, to take a medical history, and also to offer advice and suggestions on important medical problems. And by way of one way that we established rapport was in student health at the University of Wisconsin. Remember, this was in the 60s. If the patient indicated that he or she was a student, the computer offered right-on, power to the people, free Angela Davis. And that was extremely good for establishing rapport at that time. Now, the second line of reasoning was led to a set of ideas that in the vernacular of the 60s I called patient power, arguing that patients who want to should be encouraged to participate with their doctors in medical decisions and help to do so. In a sense, questioning the notion that the doctor knows best. One of my favorite quips of George Bernard Shaw years ago was, I paraphrase, do not do unto others what you would have them do unto you. Their taste may be different. And I think there's wisdom there. I also suggested that doctors and patients alike would benefit if the medical record were at last declassified and shared, and whenever possible, developed jointly by doctor and patient. Well, in 1970, I moved to Boston to join Howard Bleich in the Department of Medicine at Beth Israel Hospital and Harvard Medical School. And with the strong support of Howard Hyatt, who was then chairman of the department, Howard and I were able to form one of the very early divisions of clinical computing and to pursue our research with the computer in medicine. Howard doing, among his many seminal programs, inventing and implementing PaperChase, which was the first user-friendly online access to the biomedical literature. And in the late 1970s, with the strong mandate and support from Mitch Rapkin, resident here, now who was then president of Beth Israel Hospital, and David Dolans, who was the chief operating officer, we proceeded, my colleagues and I proceeded to develop, implement, and study a hospital-wide clinical computing system at Beth Israel Hospital designed primarily to help the clinician in the care of the patient. And several years later, we produced the same program for the Brigham and Women's Hospital. And my friends and colleagues, some of them now here as residents, Freddie Frankel, Bill Silen, Ferris Hall and Frank Epstein, whose wife Sherry is a resident here now, were all extremely helpful during these formulative times when we were using the hospitals as our laboratories to explore the good use of computing in medicine. And the theme of our work over the years with the computer was to use the computer insofar as possible as to enhance communication in the field of medicine, to use computing to improve the quality of medical care while insofar as possible reducing the cost and actually improving the relationship between doctor and patient. Clearly, there's a long way to go along these lines, but these were our goals. And in keeping with our work on communication, in the late 1970s, we implemented an electronic mail system at Bethesda Hospital, which I think was the first time an email system was available in any hospital in our country. And one feature that we built in that was very helpful, you could send a message in anger and then retract it if it hadn't been read. So you could benefit from the psychological catharsis, so to speak, without suffering the diplomatic consequences. Well, this email system was used within our walls among our hospital staff, and then with the advent of the internet, it became available for communication between doctors and patients over our secured patient portal patient site, which has been found to be very helpful. And this in turn led to the development of one of our most recent projects, InfoSAGE, which is a website, a secure personal network, a private personal network, I should say, designed to help members of families communicate with each other and with their doctor about issues of illness, health, and well-being. It's a program that we're very excited about. It's been sponsored by a grant from the Department of Health and Human Services. Our government has sponsored this research, and the leader and Dr. Charles Safran also originated the program, and he sends his best wishes to you here because he could not be here, but he is my colleague and a professor of medicine at Harvard Medical School and a pioneer in clinical computing. Well, with this session this afternoon, we'd like to introduce you to our program, InfoSAGE. We would welcome all of you who would like to give it a try, and we would welcome all of you who would like to participate with us in a study to help us to evaluate our program and thereby to improve it. And it's my distinct pleasure now to introduce my two friends and colleagues. Jacqueline O'Brien is a very valued colleague in our division who was one of the a member of the founding team of InfoSAGE and is now the research coordinator.
I'm here to sort of help with all the enrollment and scheduling and everything. So.
Thank you, Jacqueline. And Brad Crotty here, who is an instructor in medicine at Harvard Medical School and a practicing primary care physician. He was chief resident in medicine at Beth Israel Deaconess Medical Center and is doing very important work in a number of areas, but he is currently the clinical director of our InfoSAGE program. So please join me in welcoming my colleagues here.
Thank you, Warner. One of the best things that happened to me in my professional life was when I joined the lab as a fellow after completing my residency, my office where I was housed was one door down from Warner's. And in that spirit, I've continued to learn as much as I can from him and learn every day about how to make the computer better for patients, for doctors, and everyone involved. Can everyone hear me okay? Yes. Thank you. So what I would like to do is just pick up the conversation that Warner started with also some visual aids just to give you a sense of what it is that our program InfoSAGE does. And I want to start first and foremost with the goals of this project, which are stated here. One, our primary goal is to be helpful to families. Two, Warner mentioned this is research funded by a federal grant. The other purpose of the project is to learn about the information and communication needs of aging adults. And we've done this through computing, and we have built a program that runs on a computer through the internet that is a private health record, a private personal network to communicate family. We describe this in some ways as a very private Facebook, things that you would not share with the rest of the world of Facebook, but you might share with a family member, a daughter, a son, a spouse. And I work a lot on our patient portal at Beth Israel Deaconess, and one of the problems is that I hear from people who use it is that, well, it doesn't have my medicines from this hospital or my other doctor. It's just one hospital. So we've tried to design this to not be hospital-centric or doctor-centric. It's designed to be person-centric and family-centric. We also know that people are on their devices on the go a lot, and so we've built a mobile application as well. I want to share with you a few program features. Well, what is it that we have put into the program that we think will be useful to people and their families? One is to communicate updates about health, wellness, and events. And from my experience as a doctor and also with my family, there's often a lot of coordination behind the scenes, coordinating, picking up medicines, dropping off, and everyone wants to be helpful if they can, but often there's a lot of phone calls and messages. And so our goal was to try to put it all in one place. This is the next problem is very hard, which is keeping a medication list that's up to date, and that everyone knows what medicines one is taking. So our goal here is to keep the medication list up to date and allow it to be shared across the family. It can also be sent to a doctor or nurse as needed. A third feature that we built in is to keep a to-do list that facilitates family and friends to help out as needed. One of the things we found is that people go to the internet a lot to look for health information. And that may be information about specific medical conditions, or maybe it's health resources. We had members of Google, a few executives, so we did an executive training program at Harvard Medical School last week with Google, and they told me, and I knew this already, but they reminded me that there was a lot of people who are seeing their doctor and then immediately turning to the internet to type in information. And one of the problems with Google is that there's a lot of advertisements and there's a lot of, it's hard to filter out, well, what should I trust and what should I not trust? So we worked with the Harvard Division of Aging to make a search feature that provides trusted information as opposed to everything that's available on the internet. So one of the program features is to be able to search health information from trusted websites. And by the way, we will be working over time to put local Lasell information in here as well. We've already started. And the one last feature that I want to mention is the ability to record personal history and share information, pictures with your family. Warner mentioned that the work he started with taking a history and family and a medical history, and we want to be able to allow one to record their history through the program as well. This is one example, and I have selected the chair of the welcoming committee to be in the center. I had Warner there, but he suggested that Carolyn would be a good member. That's not, hopefully it does not involve me. So, but this is just an illustrative example how families really do have a network around them, and some people are closer in, maybe more involved in making and sharing medical decisions, and others are farther out, but there's a rich network. But oh, by the way, and so we built the website around networks of family members. We call the center of the network the keystone, which is a term we have come up with as a person that represents the center of the network and the center of the family. But by the way, there does not just have to be one person. You can have networks of networks, and so I've added my colleague Dr. Slack here also, and see that many of the members of the network overlap naturally. And so we built this in. I have just a few screenshots. They're not going to project well, and there's going to be more time to become accustomed to the program if you're interested at a later time. But I'll just show by way of pointing out a few features. We have a search bar on every page to search for health information. We have a task list, and it makes it easy for one to volunteer for a task as needed. We have a medication list that is shared. And an example of how we think this will help is we'll often see written medication lists down on a scratch piece of paper, and it's never in your pocket when you go to the doctor, and the doctor says, well, what medicines are you on? And you say, well, shouldn't you have the list? And so we've designed it to be freely transportable. And we built in a communication channel that, again, puts the whole family on one page when talking about sort of health and wellness updates. I want to show just an example of the search feature. I've typed in hip replacement because a friend and colleague of mine recently had one. And instead of getting advertisements for different things or different search, we have some trusted and curated resources that come up. Initially, the first couple are from the National Library of Medicine at the National Institutes of Health. I want to mention a word about privacy because health information is one of the most private and sensitive types of information we have. We've built privacy into the system. The individual, the resident, the keystone, can do everything on the site, the communication, the tasks, the searching, manage the medications, and is in charge of inviting people into the network. We have created a feature called a proxy because we know that not everyone and not every family that may benefit from this will have the Keystone be an active user, and also there may be, so people may have healthcare proxies, other proxies, but we mean proxy very generic here, which is that someone can sign in and help manage the site, and that person can also do everything. We have a role of caregivers, which do not control the network, so they can't invite other people in to the network on your behalf, but they can help with things like your medications. And then we have participants, which do not need to see your medications, but might be neighbors or people that may help from time to time. And when one is invited into the network, one assigns a person to this level depending on what they want them to be able to do. The bottom line here is that we built it to promote the privacy and the autonomy of the user, and then to proactively allow the user to invite the family in as needed. A word about here at the village. We're so pleased to be here. We've worked with the team over the last few months, which is just a wonderful team here. I know that I'm not saying anything you don't know. We're inviting residents and their families to participate in InfoSAGE. We hope it's useful. Our staff, including Jacqueline and Dee Inghorn, will be available to help residents and families sign up and learn how to do the site. This is just an introduction, but we'll have times by appointment where we'll work one-on-one and answer any questions one has. Like I said earlier, we'll continue to add in local Lasell information and resources to the site over time, increasing its value. And further, we've worked with the Wellness Center so that residents may invite Wellness Center staff to participate in the network should they so choose. This is entirely up to the resident users. I just have one word, which is just that this supplements but does not replace other ways of communication with the staff. This is, like I say, for our patient portal, patient site, this is not to be used as an emergency, but it supplements communication and may be helpful. Now, if I may say a word about the evaluation and the research study. What we're trying to do with the research study component of this program is to determine how people, together with their families, make decisions about health over time through aging, identify what information needs are, and how these needs change over time. And for those who have families that do a component of some additional assistance in caregiving, if caregiving is stressful, how can we help? And then, aside from those questions, we have the evaluation, which is this tool helpful to families? How can we make it better? What you see here and what you will see in the beginning is not the be-all, end-all, but a work in progress that we hope everyone helps us with. And we want to make it very friendly to use, and we again hope that everyone will help us do this. For the purposes of the research study, one does not have, I should say very clearly that one does not have to be in the research study to use the website, but we hope that one would participate and help us in the study. For the purposes of the study, one keystone and one supporter enroll together as a pair. And this may be intergenerational. And, but if that's not the way one would like to do it, it's not necessary to be intergenerational. One example might be Warner and his daughter Allison. Participating in the research study includes the following. One, using the site if it's helpful. Participating in the research study involves helping us meet our needs by completing some questions every 6 months. And we estimate it'll take about 2 hours over a year. And the research study is for 2 years duration. Those surveys may be completed on the computer or by phone. And if one does not feel able or is not convenient to complete the surveys, the proxy can respond on your behalf. I'm not going to show these in detail, but I'm just going to say that how one enrolls in the study, this will be really in tandem with Jacqueline in a one-on-one setting so that you can learn and we can be helpful to your learning the site. We start out by just pledging how we protect your information. We describe the study, and then we have some questions about eligibility. Like any research study, there's criteria to who can enroll in the study, and one can select, and if eligible, then can be enrolled in the study. Like I said, my colleague Jacqueline O'Brien will be meeting with residents and families by appointment. She's scheduled out some blocks of time that will be available here in the village, and we will do that. We also have, if anybody happens to be eager and willing, we also have some quick start guides if you can't wait. So that's my portion of the conversation. Warner and I would love to facilitate a dialogue and answer any of your questions. And again, it's been a pleasure working with the village staff. We knew that we were going to have to come here when Warner first moved in, and just I think every day had a new nice thing to say about how much he loved the village, and so we knew this was a very special place that we had to come to and work. So thank you all for your attention. And I think Melissa has a microphone for any questions.
Thank you. This sounds like something that really needs to be developed and something that would be very useful. I have a couple of questions, though. I'm well known here as a cynic, and I'll express that. Every time, practically, that I go to a doctor's office, I fill out a lot of information. I suspect they go immediately to a shredder and put it in, because the next time I come, they want the same information. They certainly don't share it with colleagues, or colleagues don't want it, or don't want access to it. My concern is not so much that you can gather information or that people will submit it. My concern is that it will be used by caregivers and by physicians. How do you publicize something like this in a way that makes them want to use the system rather than try to force them to use it?
That's a wonderful question. Healthcare and the processes, many of the processes are, I'll join your cynicism, are sort of broken. And this is what I find as a practicing clinician. And I think oftentimes one is asked to fill out all these forms and information just because the healthcare system requires it. It's a billing component or something. Our premise has been to be helpful to the patient and the family. So one answer is that this, leaving doctors aside, hopefully this is helpful to the microenvironment of the family. I will say that our goal is to also make computing better for the healthcare system as a whole. This will be a longer term project. We have a start, but I'll just give you maybe just a little bit of my vision, or our team's shared vision of where this is going. One is, we want to make medications a lot easier for everyone because they're very difficult and people get hurt if doctors don't know what the right medication list is and if patients and families don't know what the right medication list is. We want to make the computers talk with one another, and that's probably going to be our next phase of work so that they can be merged and mashed across. But this is a very hard problem. It's person intensive, and we're going to work on it. A second feature is that we want to be able to, as you said, obtain the information and take histories and make them available. We've started to do this some in our patient portal, and we need to do some merging, but from this project and our thinking with this project, we have brought online ability to do a family history or to complete a healthcare proxy through our hospital system, through the patient portal, and have it be available for the clinicians to see and view, and hopefully don't have to repeat those questions. So Warner, you may have some other things to add. It's a big problem. We hope to work on it, and we hope that everyone helps us work on it.
I agree with Brad totally. Am I still on? Can I be heard in the back? Yes. Great. In the very early days of our work, my friends and colleagues would say, Warner, my patients will never use a computer. It's a pipe dream. And in our experience, if we worked hard to make the computer user-friendly and designed really to help the user, be it a clinician or a patient, the clinicians and patients would use it and ask for more and more. Unfortunately today, too much of what is called the electronic medical records are not as yet designed to really help the clinician and the patient in the care of the medicine, in the care of the patient. That they're more administratively and financially oriented than helpful. And one of our goals is to have our programs be really helpful. And I've been interested that we were polled, the number of people that sign on to the internet to look for health-related information is really skyrocketing. And I think it's incumbent upon those of us working in the field to work very hard to make the information that is available to patients to be at once sound and easy to use.
I'd like to ask how your patient site, which is a wonderful adjunct at BI, jives with InfoSAGE.
Thank you. So just to repeat the question, and I'll make the question a little bit more generic, which is to say, what if I already have a connection with my doctor? I use patient site or patient gateway. How does this connect? We're in very early stages. So the answer right now is that it doesn't connect. It's meant for the family. One of the things about, I'll just give one anecdote about patient site. we desperately need to build in, and we're working on it, a way for proxies to be able to sign online and see information in patient site. I have a few patients where their family logs in on their behalf. And if that's appropriate, that's fine. One patient, one daughter, signed all of the messages with the older patient's name and tried to make them sound like they were coming from her, and was kind of embarrassed or felt like she was doing something wrong by logging in on her behalf. And we need families to feel invited into the healthcare network if that's been decided and appropriate. And so we've tried to make this family-centric. And the role of the integration is to be able to send medication lists from one place to the other, and we obviously want to do that. But the short answer is that it doesn't jive now. It doesn't replace those tools which share data. But we think on a more regular basis, a daily basis, this will be helpful for coordinating care among different family members.
Quite in stark contrast to Earl, all of my physicians and caregivers are at Israel. So in a sense, I already have this because I was at the physician's yesterday and he popped everything up on the screen, all medications, everything that was necessary for him to even talk to me. And I mean, I've been to this meeting many times, but everything was up to date, including he wanted to know when I had seen.
We can't hear you.
She's saying nice things about our computing system.
I am. Can you hear me? Yeah. Okay. It's on. Yeah. Closer to my face. Okay. But anyway, that's been very helpful. I can go on the site at my home and read what has happened, and I can look back and see when I saw another physician, my primary care person, possibly, and that happened yesterday, including looking at her medications. And so all that information is centralized there and is available to me and my husband. So it does work for me.
Thank you. I'll echo as Warner said. It is nice to hear when our systems are working and helpful.
May I ask about a system that I'm apparently in called Patient Gateway? And I'm not very computer literate, but I've given up trying to use whatever it's trying to tell me. So I hope you don't have that problem.
Gateway is a program analogous to Patient Site at Brigham and Women's Hospital. It has different human factors, but it's designed to serve the same purpose. I might say also that what InfoSAGE does is to complement what is now we'd like to think, a well-working electronic medical record system, but to be available to people whose hospitals don't even have electronic medical records. We want our program, InfoSAGE, to be available to everybody who would like to use it. And its primary purpose is to enhance communication within the family network with a focus on the older people, like those of us living here in Lasell Village, to complement whatever electronic medical record information is available, but also to be helpful on a standalone basis to people who have no other access to electronic medical records.
Thank you. Maybe my mother is unique in this, but she tends to use the physician as the father or mother confessor. She says everything that's on her mind and in her heart, some of which she would not. It might be okay if I'm there and hear it, but she wouldn't want the rest of the family to hear it. So how are you going to protect that issue with patients?
We did we did a study to try to understand this because it's such an important issue, this issue of privacy and what one wishes to share. We learned that there's a lot of things, this is not surprising, a lot of things that people do not share with their family. They don't want to share their known diagnoses, procedures or tests. And we have tried to build it in that the person that's in charge of this is not the family, but it's the term we use, keystone. That this person is in charge and decides how this is to be used and decides what and when to share it. The family is then invited in, and if invited in as a proxy role, meaning someone who logs in and helps out with managing everything and coordinating the network, then that person then has that responsibility. But it's designed, the other thing we learned is that there is no possible piece of technology that we could write that would cover the nuances and dynamics of each individual person and their family. And if we try to make it super complex and get all those permutations, it's going to make it really hard to use. So we have made some design decisions that we think are helpful for addressing this. And again, the control rests with the keystone participant until he or she chooses to invite others to take a more active role.
Our goal is to help you with and your family with that very issue.
I think you mentioned to me that one of the uses, which I think all of us would appreciate, is that the keystone, which would be any of us, would list their siblings, their children, whoever they want to be in the network, and all these people can then communicate with each other, so that if 3 or 4 siblings are visiting the parent, they don't know when each other are going, they can schedule this kind of thing, so that not everybody comes at the same time, or siblings can report to other siblings that their mother is doing very well today, I just saw them. There are all kinds of this information, which is aside from the medication issues, which help patients, families to deal with the many things that go on.
This is why Carolyn is our keystone.
I think it's unclear as to who is entering this information. Is it actually coming from the keystone or the family, or is it actually being entered by the medical professional? If indeed it's being entered by the family, how is it synced up to make sure the medication list is up to date with what the medical professionals have?
That's a great question. We're starting with families to enter this in. And again, it's not replacing the list in the electronic health record for the site, but my visual aid, it complements by being the list that is kept in the house. And it may be duplicative, and maybe it's not a necessary feature for everyone in every case, such as one who has all their health information in one place. But many people have multiple doctors, and they have multiple electronic health records that purportedly have all their information in it. And these are often never in sync. And so even though I use my type A personality to keep all of my patients' medication lists up to date, I love it when I'm seeing patients in the office or in the hospital, when a patient that I'm seeing comes in and says, by the way, these are the medications, this was added by this other provider, and these two I'm no longer taking. the medication list, as I look at it, is the thing that the one that's closest to the patient is probably the one that's most up to date and can be managed. We have a term we call, it's a process, it's called medication reconciliation, which is what clinicians do when there's an interface of care, which is to make sure that the medication list is right. But to do that, you have to take the list that's in the record and the list that the person thinks that they're taking, and then sync them. And what InfoSAGE is it helps provide the other list that's then synced. There's a lot of medication errors and assumptions and a lot of things that persist in the health record despite people like my fastidious nature that reports. So this complements it. I hope that's a helpful answer. Over time, what we'd like to do is then be able to import and export, and we'll probably start with one of our hospitals so that one does not have to be synced, do all this manual syncing. But we think that by being involved in the care, by not relying on the doctor's medication list, but by taking an active role and making sure that one knows what one takes, that will be helpful.
Oh, no, I just want to also mention that sorry. I just want to also mention that it is helpful if a patient or a family is in, if they're at the hospital and they need to pull something up, if the doctor is asking what medications are on at that time, it's something that can just be easily pulled up on the phone, or if you want to print out a list that for the medications that you've entered. And it's based on some stories that I've heard, it seems like the family are usually the ones that keep the most updated list according to their keystone. So
I might just add too that this is an evolving program, and your questions are great, and we know that we can learn a lot from you all and your experience if you are willing to give it a try and sign on and try this program out. I can assure you that we will be all ears with regard to your suggestions for improvements.
Do you see the medical directives as being part of this program?
Question is whether medical directors will be part of the program. I can say that you have an amazing staff here at Lasell who are willing to be invited in to use the program at the Wellness Center and the studios and Lasell House. Initially, put it this way, doctors and nurses are they're scared of change. Part of what we do is change management is part of our job in computing because the technology changes and we change. So it's a process to get doctors on board to use this. We're going to try to work on it because we think it'll be helpful, but it's not the immediate place to start. So this is why as Warner says, it complements other existing portals and communication like patient-side patient gateway. It doesn't replace it. We'll say you have an amazing staff here who are willing to give it a try with you.
I wonder if the people from the Wellness Center would feel that this is very useful for them.
Yes, we do. We have been working closely with the team, developing, adding resources for them to put into the searches, and we've stated over and over again that the more information we have, the more effective as a medical team we can be. So anyone who wants to invite us to join in with them, we'd be more than happy to participate with them. Information is never a bad thing.
Thank you. I just want to add to what Brad has said. the reception here has been just outstanding. All of you have been great. It's been very heartwarming. And not just here at the village, which has been outstanding with the Wellness Center and Ann, of course, and Melissa, and all your colleagues have just been wonderful. But also the college is very enthusiastic about this as well, and the information technology people there are very interested and want to help us also. So we're sort of all in this together, and look forward really to working with you and learning from you.
Unless I'm wrong, I get the impression that the assumption is that most of the caretakers and family are geographically close. Now, with families today, I don't know how true that is. I've not done any study. I know my personal case and I know other people's personal. What do you do in cases like that? How do they get together? Only through the computer? How does this work?
We think this is one of the strengths of the program, so that we can facilitate communication within families where the family members are living in very separate places.
I had another question. Unfortunately, I don't want to take a negative attitude, but how do you keep people who shouldn't have this information from getting it, such as insurance companies, lawyers? I think there's a long list, you know what I'm talking about. Because the patient can't be free and easy with all the information if they know it's going to be misinterpreted, for instance, by their insurance company.
Good question. This is the information here is kept. We keep it secure, and no one, unless directed by the Keystone, has access to it. And it is a research study, and the only people that could have access to it under appropriate rules would be a governmental agency that we're trying to look and make sure that our research was on the up and up. But that rarely happens, but suffice it to say, insurance companies would never see this, and no one, it's shared only under your control. One of our primary efforts over the years has been to protect patient confidentiality. If I may say, we've been on the forefront of that, even to the point of keeping track of who looks up information and to make sure that all users are accountable. But it's an excellent question, and it's one of our highest priority issues.
Do you foresee that people put down their medical, say their PCP, as one of their network people? Or is this only something for the family to use? I'm not quite sure I understand the meshing between the family use of this and the medical providers' possible benefit from this.
I think that it, as you said, will be most useful to the family itself, and will not, probably right now for the very foreseeable future, will not replace any other forms of communication with doctors. That being said, it's under your control, and if you wish to invite in your doctor, it's between you and your doctor. Some may not be ready for this, and some may be willing to try it. Like I said, your wellness center is, I think, on the cutting edge and willing to give this a shot and work with everyone.
But your doctor and nurse practitioner would be most welcome to join your network if you want that one.
Right.
There's one more. I think what Natalie was saying was misinterpreted by you, that she wanted to know where would medical directives be on this, such as DNRs, things that your children can see right there in black and white. Is there a list for that up there in the various categories that are talked about?
Great. Might just mention our fellows work. Adarsha Bhattacharya, who was a fellow in clinical computing with us over the last 2 years, and he worked on developing a way for people to write out their advanced directives using the computer, and we got very good feedback from that program. It's currently, we've currently put it in patient side, but we plan on moving it into InfoSAGE. It's also available. The feedback that we got was that in busy doctor office visits, there's not often a lot of time to bring up these important issues or to make sure that the right information is collected. So the computer was helpful in that way. Advanced directives also belong to the patient, but then a copy of it is put on file with the hospital. So to that extent, we fully plan on bringing up the advanced directive portion in InfoSAGE that we have created and store it and have it be available and transparent among the family.
This program teaches the user who wants to become better informed about the meaning of the proxy, offers provision for having a secondary and tertiary proxy, makes it very easy for the person to change the proxy if she or he, the user has changed her mind. And it's been very well received, and people have asked for more and more of this, and this will be part of the InfoSAGE program. And I might say, Carolyn was the very first user of that proxy program and told me she really liked it.
Before we go to the time when Jacqueline's happy to tell you about, if you're interested, how to sign up for a block of time, I really want to thank Warner and Brad and Jacqueline and this incredible team we have here. We've had meeting after meeting to really hone what would it look like if we participated in this National Institute on Health study, and we are incredibly fortunate that we've been invited to participate. And I do know that Hebrew Senior Life residents are also participating, but we have been told that we are participating in a way that they know we will surpass the Hebrew Senior Life participation. And your questions, I think, really demonstrate to me how thoughtful and how engaged you would be if you choose to sign, to enroll. And enrolling doesn't mean you have to use it every day. It actually just means you use it when you want to and provide feedback to the team twice a year. But it's what a great opportunity we have. You see that they're on the cutting edge, and we will learn how do we engage informal caregivers in our care every day, because we all rely on more than just ourselves. And Robin and the Wellness Center, we're in a unique position, because if you invite the Wellness Center in, it means that when you stop by, they have up-to-date information not only on you, but also on who you feel confident in sharing information with. So I'm going to turn it over, I think, to Jacqueline for some of the logistics. But thank you. This is a great turnout, and really thank you to all of you as well.
Thank you. I just might say that if you're interested in participating with us on this, and we hope you will be, that you'll be in a position to help us to tailor our program to your individual needs. That's our goal.
So I just want to make myself more available to everyone and try to make this enrolling as easy as possible. At the table I have some blocks of times that I'm available to come here and meet with you and a family member and go with you through the website, go through the enrollment process, and actually demonstrate the website to you. And then if there's any time on there that you're not sure about, even if you just leave your name and phone number, and I can just call you, and we can try to schedule a time to meet together. And like I said, I want to try to make this as easy as possible to meet with you, because I know everyone's busy. So, but if you want to go to the table and just look at the schedule, feel free to put your name and number there, and I'll definitely be in touch.
And with my village resident tap on or sign on, I'd like to thank Jacqueline and Brad again.
I also just want to mention that when I meet with people, it's going to be a one-on-one, so that way I can really spend some time and help you understand the whole website and everything.
A question over here?
Jacqueline, yes. Do you have an email address that we could ask our family member when they're available and then get back to you?
Yes, we actually have an information sheet up there too that will have my contact information. And even if you want to just leave your information, I can get in touch with you, and then we can go from there.
Okay, thank you.
Thank you.
Thanks, everyone.